It got real for me when we had our first positive patient and we had our first death.
Hearing the word community spread, you start thinking about ventilators to be able to help people breathe. You start thinking about how many ICU beds that you have. You start thinking about how to be able to separate patients to get enough space. And you start thinking about how to protect our workforce.
The volume of change that occurred almost overnight was unprecedented for us. We saw a almost 50% decrease in our ED visits. Through this process, we've seen about a 75% decrease in our surgical volume, as well as a significant decrease in our cardiac volume. Almost overnight, our elective ancillary testing and with imaging, lab, and other services, went away.
It was a Thursday afternoon about 12. I got a phone call that said, Brenda, we need to go full-on incident command. So it's like, okay, call everybody, we'll get going. 1 o'clock, we'll have our first full meeting. And we stood it up and met on the weekend, and by Monday we were 24/7. We've used the word unprecedented a lot.
I think about just all of the changes. I mean, things were moving quickly and changing minute by minute. I mean, we would think we had the right process in place, and then there'd be another guideline or another something from the governor. And so we would have to stand something else up in 24 hours. And not just at one facility, across all of our campuses. And, our teams at every location, just took it in stride. And they're like, okay, we've got this.
There were multiple times where you look around and think, wow, people are working really hard to make sure our staff are safe, our patients are safe, and that we're representing our organization the best that we can. So one of the things we were just recognized with was being a great place to work. And what you realize is a great place to work is also a safe place to work. And the ability to care for our customers, which are our patients and their families, as well as each other, has been demonstrated throughout the last 12 weeks in an amazing way.
The stories that we have heard regarding what our staff has done to go above and beyond tells me they love what they do and they love the patients that they care for.
I think the most important thing I personally learned is just how important it is to check in with people each day, to help them know their feelings matter, that we care about their personal experience. We know that each experience is different. And I think just reinforcing for them and validating how they're feeling, I think that's the one thing we can carry forward through this pandemic into the future.